population ages, the costs of providing emergency services gets more and more expensive. In most communities, there's a population of patients that use the emergency services frequently. It's usually 2 or 3% of the population, but it can be up to 1 911 call a week, so it really starts to add up. The Community Paramedic Remote Patient Monitoring Program integrates remote monitoring technology into the Community Paramedic Program to allow the paramedics to remotely view patients' data on a real-time basis.
This allows them to prioritize their responses to the clients that most need a paramedic response, but it still allows us to check in on all the clients daily to make sure that they are still in optimal health before they get to a crisis point.
The system is based on a cellular platform. A router gets put into the person's home, and then Bluetooth devices are enabled and they send the signals through that. So the patients take their readings and the signal gets transmitted to the paramedics where they can view that data on a real-time basis.
The paramedics came and they explained how to take my blood pressure. I already knew how to take the oxygen level, and of course the weighing in I know. I take my vitals every day, and if there is any concerns, it's not just right. Within about a half an hour, I get a phone call, and they just wonder what's up, and it's wonderful. I'm in good hands, like I trust them completely.
By doing in-house reading, they are able to stay in the home longer because what they do is eliminate the number of trips that they need to take to the hospital. And that's very significant to the patient, to the healthcare system, and to paramed care.
Queen's University is doing the evaluation on the program. Their numbers are estimating that the savings per patient per year is about $10,000, and that's about a 500% return on investment.
It's a huge cost reduction to the municipality because they share in 50% of the paramed budgets. So where you have a savings at the provincial level, you also have it at the municipal level if this is in place. There are 6 CFTCs involved in our project, and they include North Simcoe, Orillia, Collingwood, Saugeen, Waterloo, Wellington, and Bruce CFTC. And if they hadn't stepped up and if they hadn't believed, we wouldn't be doing this because it's not our typical economic development work. We're founding something instead of just copying something. And I think there's huge value in that.
The benefits speak for themselves. It's not just a dollar savings, but it's about quality of health and the way the clients themselves feel that we're a vital part of their wraparound care. The doctors like it. They're becoming participants in their own health care.
I think the whole thing was intended to serve the patient first, and I think that's the success of the program.
It's very comforting, so I don't want to be left. I want to stay on it, and I would recommend it to anyone.